8 cholera patients in South Sudan, including 5 children, perished after they were forced to embark on a grueling 3-hour walk in scorching heat to reach a functioning clinic, according to a UK-based charity, Save the Children. With US funding abruptly severed, cholera patients were left with a brutal choice: stay home and die, or embark on a 3-hour walk through unbearable heat for a chance at survival. The deaths are among the first to be directly attributed to aid paused by President Donald Trump's America First agenda. Save the Children's country director in South Sudan, Christopher Nyamandi, said there should be global moral outrage that the decisions made by powerful people in other countries have led to child deaths in just a matter of weeks. In Jonglei state, where malnutrition and disease are already rampant, local health facilities have long served as a fragile lifeline. But earlier this year, something changed. The US, once a dominant force in humanitarian aid, slashed its funding, forcing clinics to shut their doors or operate at minimal capacity. Without transport services to ferry the sick, families had no option but to set off on foot, carrying their weakened loved ones in a desperate attempt to reach medical help. For 8 cholera patients, including 5 children, that journey was their last. South Sudan, a nation born from bloodshed in 2011, has long relied on international aid, particularly from the US, which played a key role in its independence. Billions of dollars have flowed into the country, funding healthcare, food security, and conflict prevention, but geopolitical interests shift, and suddenly humanitarian efforts weren't quite as strategic as before. Experts caution that the aid cuts could cost millions of lives in the coming years due to malnutrition, AIDS, tuberculosis, malaria, and other diseases. A spokesperson for the U.S. States government and the U.S. State Department argues that many U.S. government programs providing life-saving aid in South Sudan remained active. However, that support for medical services had also been used to enrich the country's leaders. The spokesperson said, "While emergency life-saving programs continue, we will not, in good conscience, ask the American taxpayer to provide assistance that effectively subsidizes the irresponsible and corrupt behavior of South Sudan's political leaders," adding that the U.S. State Department did not have information about the deaths reported by Save the Children. According to the World Health Organization, cholera broke out in October 2024, and over 22,000 cases had been recorded as of last month, March. In addition to the health crisis, over a third of South Sudan's roughly 12 million people have been displaced by either conflict or natural disaster. The United Nations also reported that the nation is on the brink of a new civil war. With all these crises, one can't help but wonder what the future holds for South Sudan. What do you think? Share your thoughts about this story in the comments below, and don't forget to like, share, and subscribe to the News Guide for more of these updates. My name is Nelson Kofi. Thank you for watching.